Hello, audience. I welcome you to a short 20-minute presentation on the management of interconnected health systems and what to consider and what to watch out for to improve quality and outcomes, or on the other side, what could go wrong. And the awareness is a major topic here. So obviously, we will be in a setup where digital information, digital connection is dramatically more important than it is today. Hospitals, outside stakeholders in the healthcare systems, devices that connect, also like systems and companies, ambulatory services, ambulances that connect. So all of these need to be connected to make sure that there is a proper workflow and a workflow that basically ensures quality and ensures that we analyze health status properly. So first I want to start with the disclosure. I'm the scientific and business advisor to Visus, GmbH, and the Teleradiology Network. I also have connections to quite a bit of startups. There is no, while that topic may fit to these companies, there's no slide that I use or no information that I used from them. So let's start with analyzing the topic. So management in general deals with controlling processes and people and controlling them obviously in the positive way. A healthcare data network is a network that uses a common data model and makes it available to the users, this data. Now, connected health, if you look at it from a socio-technical model, is a management system. So dealing with the data points that is set up around the patient. And it's obviously there for the healthcare professionals, everybody that is a stakeholder in that system, and employs software and hardware, and also is able to do things remotely. I think that was one of the first applications for this type of networks. Inter means in between, Latin. So if you really put this all together, it would be dealing with health data networks for users that allow remote healthcare services and information exchange among these networks for the benefit of the stakeholder and the user. So the learning goals for this presentation should be actually the move from telemedicine to telehealth, and now to connected health and on to digital health, or what are the differences, and how can we distinguish between these future demands, and also the limitation with human performed health, or the way we do it right now, and what potential benefits digital systems could be. Also talk about the patient-centered health approaches, so an empowered patient that is able to use digital technologies at home and wants to obviously use them in combination with other technologies, wants to provide information. And I also want to highlight some of the issues that we have with implementing these systems, particularly with respect to the quadruple aim of healthcare development. Some say triple aim. I'll talk about this later on. So COVID-19, allow me this chart has actually shown that we are, while a lot of people believe we're years away from a digital environment and from an environment that allows remote services. It has pretty much come like that, because with the isolation topics, with the topics of actually not leaving your home, keeping distance, it's very difficult to perform medical services, and it would obviously be beneficial if we would be able to do those remotely. So these connected services, they have started basically as telemedical approaches and telehealth approaches, where you were able to basically talk to a physician, communicate with the physician, with the clinical health provider over a distance. So particularly in areas where there was no medical service available or no specialist available, you could actually communicate, but it's rather more a communication system than anything else. And from there, it developed to a further and a more advanced system, basically covering not only data communication, but also data acquisition, data utilization, work on data points, and providing actually further information to the users. So today it has a much broader concern, particularly related to cost quality and efficiency of healthcare provision, and obviously it could make the patient be in charge of his own data, being in the center. And while this is a hope, I think it's a future, definitely a future goal, and we should work on all sides, and will work on all sides to make that happen. So also COVID-19, allow me that one as well, has actually proven right now in this crisis to be beneficial. And this is a statement from the White House with respect to that. But it also has shown quite a bit of deficiencies in the entire setup and in the entire systems. So it is not just having a communication with the doctor. I mentioned it started as a telemedicine setup, as a telecommunication setup, basically people talking about symptoms, doctor analysis. Now you're actually able to have all kinds of devices at home that could be put together in a common data frame, and then exchange, maybe even using a program that analyzes the information beforehand and submits a report to the doctor, which you can follow up then on a communication. There's a lot of these different systems around already. You can have diagnostic information, you can have information about your pharmaceutical use, genetic information. There's a lot of facilities around, there's a lot of technologies available, analytics available, health available, and all of these need to be combined to actually make sure that we have a properly functioning system that is able to exchange information and not and ensuring that you don't double up on information gathering. So it's very easily said, and it's very easy put in a graph. But let's face it, it doesn't only come with a graph. It comes with hardware and software, and it comes with systems in place. So it comes with that, comes with cost in place, an initial cost in place, which is a burden of entry and a hurdle of entry. And it needs to be somehow mandated that everybody is using equipment that is interchangeable, that is talking to each other. And if that's not the case, you have a weak point already in the whole system. So it's covering processes, technology, and people. People, I want to start with those. People need to be educated, need to be trained, need to put trust into the system. Technology needs to be able to acquire data points, unbiased data point. That's also a software part. Unbiased points, points that are unambiguous, sensors that are comparable to each other, taking into account the patient's not only behavior but status. And there need to be processes in place that actually use these technologies in this triangle of functions. So this connected health only works and when we are able to bring all these different entities together, the patients, the stakeholders, the ambulatory services, the home care services, the outpatient, inpatient services, if you bring them together and create a complete ecosystem, and only then it's efficient and effective for the users. So some of the issues that we have to deal with, we have to, and some of the positive and negative points and some of the stakeholders, we have to deal with latencies, so delays in those services, need to deal with those. We need to obviously have a very accurate and timely resource management. We need to have, we need to be able to reduce manual executions and with that human errors. This is some form of the ambiguity and the subjectivity that is the system, and digital systems could actually help to take those out. Then we need to share information, not only share information between humans, but share information between systems. If we do that, we can gain additional intelligence, additional information that also will help us to move away this acute disease treating setup to a more preventative setup. And once we have all these data collected and we have a big data approach, we can use deep learning methodologies to actually come up with conclusions that we could not even see and imagine at the moment. So who are the stakeholders? There's a lot of institutions involved, and they're more or less complicated, more or less nimble. Actually, most of them are nimble. Government is very nimble. Healthcare organizations are nimble. The citizen is probably a little bit more agile. So, and you need to also look at it from not only from a national, also from a global level. Research entities need to be included. Otherwise, you will not probably get to the benefit of analyzing the data to provide a bigger value to society. So moving on to digital health. So once we have these systems in place, we can actually employ computational power. We can use smart systems. We can use AI, deep learning methodologies to be able to not only monitor diseases, but also to be able to have information available that will promote health and well-being in the future, prevention. So moving away from a monitoring disease monitoring point to a disease prediction point of view. And if you want to invest more time in the innovation process itself in digital health, you need to understand healthcare problems in depth. You need to go out and check them out, basically camp on site and find them out. You do some research on it, maybe find a digital solution, check this digital solution, evaluate, iterate, and then subsequently implement. This is an innovation process. I use this. This is part of a bio-design process, and I would refer you to the innovation generation lecture that I read on that topic. A topic you can learn innovation generation, a topic that includes a lot of different types of innovation generation techniques. I'll have a chart on this one later on. So the aim of healthcare developments in the future, and that includes all these digital systems, digital health within these connected systems, is to not only improve clinician and patient experience by providing them information, but to obviously improve the outcome, health outcome. And what researchers sometimes forget, cost is a massive issue, and cost needs to be dramatically reduced. We have ever increasing costs in the healthcare system, and it's eating up a lot of the GDP, and will obviously cause massive problems, particularly people who do not have these kind of resources available. Now, some other people call it triple aim. Some other researchers here is only missing the clinician experience. I'm not sure why this is the case, because clinicians obviously will be very paternalistic about changing things if they're not being heard and their experience doesn't improve as well. So getting a little bit more into depth, so far we have talked about what the general outcome should be, but now let's really go dive into a little bit more. We have all these type of sensors, so you see them on the top right. You can do your oxygen saturation, you can look at inhalations, weight, all these data points that are connected and very often connected to a local interface and that are personalized to a patient. They are important data points about the behavior, about the well-being of a person. This patient information needs to be, and it is already done, needs to be compiled, needs to be put together, which is not happening for that matter. All these have different interfaces, and provided, used via internet to have a direct link to the doctor, have a direct data point to the doctor, and all the other health data points that are connected, that are collected, during the life of this patient, need to be collected and made available as well. So there needs to be a common setup, a common denominator, and a common data point where all these devices provide something that is readable by others. And we need to obviously address, as part of this, a lot of these concerns that patients and caregivers and organizations have about sharing the data, access of the data, trusting of the data, ethics behind the data, sharing of the data. So this needs to be covered, so there needs to be security items built in as well. So even more complicated, now we're having, we extended to data queues and event queues, and we have healthcare bus systems, and we have APIs, data systems, we have security gateway, all of this connected. And you already see here that there is issues with respect to data federation, mediation, accessibility, security issues that built in. We have very complex events that need to be processed. And we have a lot of development aspects. What are we going to do with this data once we have it? How do we attach it to a patient without really having it attached to the patient, so it cannot be recognized? So there is some white papers being developed for that. And this is some of the concerns that you need to take with you to actually improve quality and outcome of these interconnected systems. So getting to the end, to build the future of health data and these networks, we need to provide benefits to the organization as well as benefits to the patient. It needs to be connected to the health data that are gathered during the life of a patient. That is also respected to socioeconomic effects, to the environment they live in, because then we can make we can return to actually finding out what is the effect of certain aspect. It needs to be timely available. We need to build trust. And so at the end of the day, all these institutions need to work on shared values, which are not completely defined yet. We need to have a common understanding of ethics. Ethics is a subjective, information that not everybody sees it the same way. So we need to have some guidelines on this one. And only if we have that, we'll actually provide the benefits to everybody, which is improved outcome, economic aspects, and obviously improving of the disease patterns and maybe improving of the cures. So I've actually come up with that with my own digital twin approach that I published this early this year in the SBIE magazine, where you actually have a personal record collecting approach. So you basically use all the devices, and there needs to be an interface system which creates a personal a health record change. Monitoring is very important, using all the wearables. You also use all the information coming from the professional care side, and which is then an electronic health record. All of these need to be put together to create some form of a digital twin of you. This is not a new idea. Siemens already came up with this and others, but we need to employ lot of exponential technologies to not only make sure that there's something good coming out of it, something predictable coming out of it, but to also ensure safety and privacy. And governments need to be ensured, regulatory bodies need to be ensured, insurers need to be involved. So as a summary, we'll move to digital health. So not only having these interconnected systems, but actually using the interconnected data systems with further analytics to create data points and evaluations that benefit the patient and the entire system. Well, for that, we need standards. We need to make them to make data available and interchangeable without jeopardizing the safety and security of the patient data. And we need to trust what's being put into these systems and what's coming out. So we need to probably have entities checking some of the things and ensure maybe some checklists. I'm a little bit concerned about this part, particularly also the data in component, but I'm sure that we'll figure something out on this one. Having all this, we have 24-hour accessibility, we have a faster response, we have reduced, and I wouldn't say no human errors, that's wrong, but we have reduced human errors significantly, and we hopefully have with that less acute therapies needed because we have prevention possibilities. So it is essential to have these health data networks in place and the management in place, have reliable communication, fast communication. Other than that, we cannot guarantee future health developments the way we are planning them. So my references are listed here. And with this, I thank you very much for your attention. And if there's any questions, please get back to me. Thank you very much.